All right, I'm here now with Dr. Ilan Danan, a sports neurologist and pain management specialist at the Center for Sports Neurology and Pain Medicine at Cedars-Sinai Kerlan-Jobe Institute in Los Angeles. Thank you so much for joining the program. We're talking about Markieff Morris, who has missed now more than a month after sustaining a whiplash injury on November 8th. Is that a normal amount of time for somebody to be out with that kind of injury?
When it comes to whiplash injury, we think of it as more of a musculoligamentous strain. On average, individuals can experience anywhere from, let's say, 2 to 6 weeks of pain and discomfort, tenderness, limited range of motion, things of that nature. To answer your question, yeah, in many instances, it's not uncommon if individuals need several days, if not even a few weeks, in order to fully recover.
What would an injury like that feel like when it first happens, first impact? Because some people were accusing Markieff for just sort of milking the moment, trying to draw a foul. But what would that kind of pain be like that he was experiencing?
Right. So not to get into, accusations of things, but I would say in answering that question, oftentimes patients can feel an immediate onset stinging sensation in that region. It can be almost immediately sore. Think of it as almost kind of like a direct, let's say, punch to an arm in that regard. So very achy, sore feeling, and obviously wanting to be very cautious and not wanting to aggravate the neck by rotating the head too aggressively otherwise thereafter.
And then what are some of the long-term impacts or problems associated with the whiplash injury? Would there be concerns, or what would your concerns be if you were the team physician that you'd be looking at?
Typically, there aren't many long-term impacts to it. In many instances, individuals will recover with appropriate rest, soft tissue work. Think, heat, massage, icing, analgesics in terms of medications if necessary, anti-inflammatories, maybe even muscle relaxants and such. But in terms of long term, it would be awfully rare. Some patients may experience some headaches associated with it, and very, very rare instances we'll have individuals who may complain of some degree of imbalance, but that's relatively uncommon.
Is that something that Markieff would be experiencing maybe at this point, now that it's been a month later? And if you were experiencing those sort of rare symptoms, obviously I'm sure he'd be communicating that with the team doctors and stuff like that. But that's something that could, I would imagine, prolong the rehab process.
Yeah, not being involved in his care, I can't say with certainty, but I would imagine certainly aside from the direct neck-related complaints, there may be some complaints in regards to headache-related symptoms and things of that nature. That's not uncommon given the location, especially if the strain is more towards the base of the skull or top of the neck. It's not rare for patients to also endure some degree of headaches, what are called cervicogenic headaches in association with the neck pain.
So it sounds, other than those rare type of instances from a performance standpoint, there's really no reason to think that he couldn't sort of return to his pre-injury performance level, is there?
Correct. Other instances where if things do get prolonged, you start to worry if there's anything else aside from just a soft tissue strain or a musculoligamentous sprain, and you start worrying about, for example, the discs of the cervical spine and things of that nature. So if symptoms get prolonged more than they should, and patients had received appropriate treatment for a soft tissue injury, and it's been the better part of several months, for example, and they haven't recovered, that's when you'd start to dig a bit deeper and maybe do additional forms of testing, specifically an MRI of the neck or cervical spine to assess even further.
That's interesting because, like I said, it's been I don't think anybody expected him to be out for more than a month and miss as many games as he has. And let's just say, hypothetically, if he were to miss another month of games, and he's been on the court warming up before games and stuff like that, so I'm not really sure what that means. And I'm not
Sure.
going to ask you because I know you're not directly involved in his care. But if he were to miss like several more weeks, for example, like that might be a sign that there's something more than just whiplash, which is what the team has been telling us.
The only thing I would say to that is that you start to wonder, yes, if there was, let's say, injury directly to the cervical spine or the disc specifically, but I have to imagine they've they've done the appropriate testing, even at this stage.
Okay.
I imagine that he's probably had advanced forms of imaging to assess even further. The other concern is, as you mentioned, he's on the court, but he's not taking part in contact related activities, i.e., in game. I don't know if he is taking part in full contact in practice, but obviously circumstances are very different when it comes to soft tissue sprains and injuries to the soft tissue of the neck. When you are in control of your surroundings, i.e. in a non-contact setting, versus in a contact setting, i.e. in a game.
And then just sort of zooming out on Whiplash as an injury, is this, obviously in basketball, reporters, we hear hamstrings, ankle sprains, like those sort of things all the time. Whiplash to me is a rarer thing. It's not something that comes up on injury reports very often, but in your experience dealing with athletes, is whiplash rare? What sport do you see it most in, and what do you think is maybe the most misunderstood thing about whiplash as an injury?
Yeah, I would say you see it less in basketball, for example, likely because there's not much that's done above the shoulders when it comes to basketball as a sport. But in other sports where there is a lot more contact, football, soccer, ice hockey, that's a lot more fast paced. Skiing, water polo, we'll see it. So there are certainly sports where above the shoulders or above the neck injuries do occur. For which whiplash can very much be a bit more of a common incident or injury.
And what's the normal timetable for return for in those sports? I know it's a completely different sport than basketball, but I'm just curious.
Typically, anywhere from I would argue the better part of 2 to 4 weeks. In rare instances, maybe 6 weeks. But we take the sport into consideration as well, right? And what I mean by that is if a patient's at, let's say, 100% after 3 weeks, we wouldn't send them right back into sport, full contact, 3 weekend a day. So with the understanding that threshold for re-injury is still a bit lower. So we want to make sure that we're lessening the likelihood of re-aggravation and recurrence. And in doing so, making sure that we're really maximizing the time of recovery so that there's significantly less likelihood that they're going to re-aggravate that injury.
Gotcha. Well, those are all the questions I had for you, Dr. Danan. I do appreciate you taking the time here again.
Great. Have a great day.
You too. Thanks.
Bye.
Thank you to Dr. Ilan Danan for the interview.
Yeah, and thank you so much for making Locked On Heat your first listen every day. Remember that every episode is free and available wherever you get the show. Make sure you check us out on Wednesday night. We'll be doing a live recap of the Heat taking on the Philadelphia 76ers. It should be a great game, and we want you all there with your questions, comments. Again, we love to interact with all of you, so make sure you check that out. Wednesday night is going to be a great time. Had by all. And make sure you also checked out Locked On Bets, your daily one-stop shop for all your gambling needs, hosted by your boy Q with expert analysis and insight from Lee Sterling. This is David Ramil signing off for now. Thanks for joining me, Wes.
Wrap it up, B.